Hello and welcome to another GIS feature with Health in Perspective. Today we're here with the Chief Nursing Officer, Ms. Jacinthe Hannibal. We're here at the Stanford University Chronic Disease Self-Management course. Now, Ms. Hannibal, the course which started on October 27th and it's going to end tomorrow on the 30th. Tell us a bit about the workshop and how it came about.
Well, thank you, Natasha. In June of this year, I did a training in St. Lucia. So I'm a master trainer for the program. However, the program has to be conducted with pairs of trainers. So this program that we're now doing equip persons within the community to be leaders, and they will be able to help me to carry out the program or to conduct the program throughout the territory. Now, the Stanford University Self-Management Program for Chronic Diseases was designed and tested in the United States. However, there are several Caribbean countries, including Barbados and St. Vincent, who are doing this program. And they've had some very good results. After the training, I thought it was a very good program to bring to the BVI in order to complement our chronic care model, which we've decided to adopt in the Ministry of Health.
Tell us a bit about your objectives and what you expect to achieve as a result of the workshop.
Okay, well, this workshop, we have on board 10 persons who are training as leaders. Hopefully all 10 will be certified as leaders. We hope now to go out into the community, conduct participant workshops. What this means is that if someone is diagnosed with a chronic disease, they can be referred to that workshop or they can apply to come to the workshop. And that workshop is geared towards enabling them to have skills in order to better manage their disease. So the workshop looking, how do you make a particular decision? It gives you skills that you can actually use to live a better life, even though you have chronic disease.
Now, you mentioned you have 10 participants. Give us some insight into the level of interest you receive once you sent out that call to have people train.
At first, we had quite a bit of calls. Persons were interested in the workshop itself. However, when we told them that we were looking for leaders, a few persons decided they would come to the participants workshop, but not necessarily the leaders workshop, because there's some time commitment. The workshop went for 4 days, and that was a deterrent to be that way. So I think in a wider population, based on the amount of calls that I received, there is an interest for the program.
Now, with chronic disease and chronic non-communicable diseases being at the forefront of health right now, how do you see this workshop benefiting participants and, as you say, long-term, the wider community?
Okay, well, the Ministry of Health has adopted the chronic care model as the way we want to move forward with chronic diseases. And that model looks at strengthening the delivery system. So there are some things that we're doing with the hospitals and even the private care centers. And it also looks at how do you collect your statistics? How do you make sure that the statistics that you're collecting is infiltrating into, data collection and making better decisions for healthcare? This program is another part of that chronic care model, and it looks at preparing persons to take charge of their disease. So you might have had hypertension for a very long time, but how do you live with that hypertension? It's not just about existing, but living a better life. Now, if we can impact each person that is living with a chronic disease, we hope to have a healthier community, because one person can impact another person, right? And the tools that we're giving are tools that you can use not just for chronic diseases, but you can use it in your daily living. Right? So we hope to impact every little aspect. Maybe I'm being over-ambitious, but I hope to impact every aspect of self-care management in the BVI.
What are some other initiatives that you have coming on stream, all bringing it all together to improve the quality of health care for the people of the Virgin Islands?
Well, I mentioned before the parts of the chronic care model, and that looks at strengthening the delivery systems and such. But there's also the community engagement and the community development aspects of it. You would have heard recently about the program that we're having in the schools, the high schools, in terms of making sure that persons know how to eat better, know that the importance of exercise. And all of this is based on some of the research that we've done in Unity. So that's one aspect of it. We had a 10,000 steps program. That's another aspect of it. Then we're looking at how we develop the community. If you notice there are parks being built, if you notice there are sidewalks being built, that will engage persons or to enable persons to walk more, right? So there is a multi-sectoral approach to chronic disease. There's a coordinating team, and that coordinating team looks at different aspects of the community. All of that within a framework of geared towards improving the incidence of chronic disease in the territory.
After this training has already taken place and persons would have been established as leaders, where do you see that program going, and how will the leaders now contribute to that level of care?
Okay, so we hope to at least run one workshop, one participant workshop each quarter, starting in January or February next year. Each workshop can have a maximum of 18 participants. So if we can engage 18 persons 4 times next year, then we would have made a dent. We would have liked to have some trainers from some leaders from the sister islands. That was not so this time. However, we have equipped persons within the Ministry of Health that will be able to extend ourselves to the sister islands in order to carry out those workshops. So we hope that if we enable persons, as I said before, if we enable persons to take better care of themselves, self-management, manage the disease better, then we'll be able to impact the quality of life that those persons can live within the territory.
We're here with Merlin Meisner, and she's the master trainer here with PAHO. Ms. Meisner, tell us about your affiliation with this training course.
Sure, hi, and thank you for having us. My affiliation with this training course, I was trained as a master trainer 3 years ago in Miami, Florida, by a teacher trainer. And I have been teaching this workshop in Miami and Fort Lauderdale, South Florida, for the past 3.5 years. And it's been very successful.
Now, with your extensive training teaching this workshop, what type of benefits have you seen so far from those 3 years?
So not only have I been teaching this workshop to actual participants, but I've also been teaching leader trainings. So people can go out into the community and teach this program to other people in communities all over. So today I'm here in Tortola teaching people how to disseminate this in the community. Some of the great benefits of this particular program, I've seen people come in and they can't really walk very well into the workshop, and by the end of the 6 weeks, you see them empowered to walk by themselves, even bringing in some water because they want to increase their water intake. So those are some really key things. Some people come in not as encouraged that they can do things themselves. So by the 4th and 5th week of the program, you see them saying, I can do this. I can manage myself, and I don't need to let the disease take over my life. I can take care of myself.
Awesome. Nice story to hear. And I think a lot of people need to have some level of appreciation for that, the community approach to healthcare. And thank you very much for sharing that. You alluded to it a bit, but tell us definitively, why is a workshop like this so important for people with chronic diseases?
Yeah, so we've noticed in the community that everyone goes to the doctor. And the doctor always tells them what they should be doing, or the nutritionist tells them what they need to be doing. But when they go home, they don't go and do it. So a lot of times this type of approach where you have lay leaders, people from the community that actually have the same conditions or live with someone that have chronic conditions, they're the ones that actually see, they help each other out because everyone has the same issues. They have the same type of symptoms, the same issues in communication or even pain, even feeling a little depressed. So everyone can help each other out, which is different from someone telling you what to do. This program actually empowers you to decide what you want to do.
Nice. Now, after that, we need to know some of the key components of the program. What are some of the components? What are some of the key messages that you're leaving with the participants?
The participants go away with a major 3 skills. Number 1 is action planning. Knowing that they can say, I'm going to do something, and they get it done. And if they don't get it done, they do some problem solving skills. And with problem solving, they decide what they needed to adjust in their action plan to make some kind of change that they want in their life. And then we also help them with decision making. We have a lot of hard decisions to make in life, very difficult, and they come away with how to decide approach or decision for their lives.
Awesome. And speak a bit about some of the feedback you've been having. How receptive are the participants, and what are some of their highlights?
Sure. So we've had really great feedback from them. We always ask if there are any questions and everything, and their feedback is like, wow, you guys are really listening to what we're saying. I appreciate that you're giving the opportunity for people to express themselves and you don't cut them off. We also are very welcoming to everybody's ideas. We don't judge whatever idea people have. Allow everyone to have the same equal value for their contribution to the workshop. So when we do brainstormings, for example, in problem solving, we have brainstorming activities and everybody gets a chance to contribute to those ideas. And everybody is treated equally so that there's no preferential treatment, there's no attention given to one particular person, but everybody's being part of it.
Mm-hmm. One of the major health themes that we have here locally in the territory is towards a healthier Virgin Islands. How do this workshop play into our overarching theme?
The population here does have significant chronic disease population, and a lot of times that is what's really taking down the health system. There's so much money and economics being spent on taking care of these chronic conditions that if people would take classes like this, they can see they don't have to spend that much money. And the government doesn't have to spend that much money on taking care of somebody with chronic conditions because they themselves can take care of it. And overall for BVI, it could mean saving some more money.
We're here with Ms. Tomo Kanda, and she's the advisor on chronic disease with PAHO. Ms. Kanda, tell us how you are affiliated with the training course and the affiliation with Stanford University.
Yes, I am advisor for chronic disease in PAHO. My responsibility is all Eastern Caribbean countries. Pan American Health Organization, we have been supporting all Eastern Caribbean countries to improve quality of care for patients living with chronic conditions. And based on our assessment, we identify one of the components is self-management. British Virgin Islands is not exception. British Virgin Islands has quite strong, organized, well-established healthcare services. However, providing only guidance, instruction, and the medical advice doesn't help to patients to improve their health outcomes. This is the reason why we PAHO exchanged license agreement with Stanford University on chronic disease self-management program. So this license allows us up to 3 years from now to support all Eastern Caribbean countries and train the trainers for the Stanford program.
Mm-hmm. Now, why is a workshop like this so important?
As I said, one of the most important components is how we can empower people living with chronic conditions. Self-management, self-efficacy is the key. So throughout this training and workshop, those people who attended our workshop will really increase their self-efficacy and then self-confidence level, be able to manage their life instead of being told you have to do this. So this is an important component.
And among that component, what are some other key components of the program?
There are several key components. One of the most important components will be we have to identify leaders coming from the communities. Those leaders, we are not looking for only health professionals. Hopefully, non-health professionals who are also living with at least 1 or 2 chronic conditions, such as diabetes, hypertension, could be arthritis, because those people can really understand challenges and difficulties living with such conditions. So this is the most important component. We train them, and when those leaders are qualified as really leaders, they will go back to the community and they will identify the people in needs, and then they will duplicate similar training for the people living with chronic conditions.
Now, as part of that training, the other people who may have chronic conditions, how do you see that contributing to the quality of life for persons with non-communicable diseases?
Well, this training, throughout 4 days training, all the leaders will acquire 13 different tools. Most likely, most of the cases, patients with chronic condition can manage their condition by themselves. For example, how to make an action plan, and how to make a decision making, and also how to problem solving. And then we also learn healthy eating, medication, sleeping, and all the different tools. So this is a very important component for the training. The key message for them is once they complete this very intensive training, first, they should believe this training works. And then the second, they really have to go to the community. Again, traditional way of medical advice is the healthcare is always doctors, nurses give the instruction, guideline, and also suggestion. We also have to improve their self-management skill, and this workshop really strengthens this self-confidence and also management skill.
Now, moving forward, what are some of the short, long, and medium-term goals for this program?
The short-term goal, probably as soon as those leaders are qualified, they have to go back to the community and identify potential partner, which means local implementation partners. Those are NGO, Diabetes Association, and Hypertension, Arthritis, Cancer, those NGO, or like Royal Club, Rotary, and then any kind of NGO who will be the partner for implementation of this program. And those people who are actually working in the community and serving the service for the community, they will identify people in needs. So this is the first time, the short-term goal. We have to identify good partners for the sustainability. The second, once we identify the partner, second, we have to think about more organizational structure change, meaning not only health sectors, but also how the community can make a good linkage with the government, particularly Ministry of Health, like education, and so on. So making a good linkage with all the stakeholders would be midterm goal. And the final long-term goal, obviously, we want to empower all people living with chronic condition in BBI, making sure they can manage their condition. Being a diabetes, being a hypertension is not the end of the world. They can still eat the things they want to eat. However, how they can watch portion size, how you prepare healthy choice is important. So long-term goal, I'm very much looking for the people living in BBI, they will acquire their health improvement by themselves. BBI is a very unique island. Almost 70% population coming from different background, different islands. So your country is very unique. I think this program has a great flexibility. It will fit very well.
We're here with Mrs. Joan Tony, and she's representing the BVI Diabetes Association. Mrs. Tony, tell us, why did your organization attend the training?
The reason why the organization we attend this training is because we deal with diabetics, and I'm a diabetic myself, and the experience would be good for me and I'll be able to help others.
What are some of the key messages that you're going to take away?
Well, the program is going real good, and one of the key message I'm going to take away from this program is how to deal with people, because sometimes at the Diabetes Association and as you go around the community, there are difficult people that you have to encounter with. Sometimes you had to reach them, but this program is encouraging us how to deal with these people when we meet them.
Now, moving forward, how do you think you will apply the information you've learned, or what do you think you'll do with the information following the training?
And we usually have meetings every second Wednesday of the week, where sometimes we have healthcare professionals come in and give their input. We have the doctors or dentists. So with this program now, we can go there and start practicing what we have learned and impart it to others.
Now, how do you see that link between the information you've learned attending the course and what you do at the Diabetes Association? Do you see a link in it, and how do you think that the information moving forward would help to assist the people that you deal with diabetes?
Yes, I see a link in it because we've learned how to, for instance, we learn portion sizes, and at Diabetes Association, diabetics should have a meal plan. We have learned the meal, how to read food labels, and meal plan how to have portion sizes, and that when we go there now, go back to our office, we'll be able to help to teach others directly how to manage their diabetes.
We have with us one of our regional partners, and she is from Anguilla. She is a non-communicable disease program officer, Ms. Fidelia Richardson. Ms. Richardson, welcome to the BVI. Tell us, why did you attend this training this week?
I'm here this week to receive the training for the self-management of chronic diseases, so that my director of the unit that I work in, she already received the training, and so she needed a co-leader to facilitate these trainings with her, and so I was the chosen person to come and receive the training.
And so far, how is the training going for you? What are some of the things you're going to take back with you to Anguilla?
Well, the training is extremely beneficial, and I definitely can see how we can use it in Anguilla. We often find persons often will quickly run and go to a doctor when it's something that they can definitely manage on their own. And so I think the training is definitely going to help us to be able to help persons to take care of themselves, and I think that is very, very important.
In a small community like Anguilla, it's a bit smaller than here, but talk about the importance of that community approach to managing chronic diseases, and do you think it'll work in your country?
We are about 35 square miles, and we are community oriented. However, persons tend to be very, private. They tend to be quite private about their issues with chronic diseases, and I definitely think we need to work on that community spirit when it comes to helping each other dealing with these chronic diseases.
And what are some of the key messages you'll take away, or what are some of the things that inspired you about the training session?
I definitely enjoy the communication skills section. I definitely think that is something for not only chronic diseases, but for in life in general. I definitely think that will be an asset for even my life. How we can relay information in a way that doesn't make it come off as aggressive or argumentative. So I definitely think that was beneficial for me and for the way I will go about teaching these self-management trainings.
Thank you for tuning in to this special GIS feature where we were here at the H. Lavity Stout Community College attending a workshop where we partnered with PAHO and the Stanford University to present a chronic disease self-management program. We spoke with a number of persons today, all trying to educate the community on the importance of such a program and how it will impact the community moving forward. The wealth of the territory is the health of the territory. Reporting for the Ministry of Health and Social Development, I am Public Health Communications Specialist Natasha Letzum. Thanks for tuning in.